Interpretations. First of all, look at this. Left ventricular and diastolic pressure or filling pressure. Basically, it's the same term as preload. You can say that. And it's equivalent or roughly equivalent to the pulmonary artery wedge pressure. As we said in our clinical practice, to be honest with you, because we use one mainly in cardiology cases, and most of these patients sometimes have a balloon pump or impella, or they don't want to malposition the catheter. They rely on the diastolic pressure of the pulmonary artery, as we just explained. Basically, they run the wedge pressure once, and if it's close to the pulmonary artery diastolic pressure, they just go by that. And these are rough numbers. Again, these are assuming that you don't have problem like mitral valve disorders or things that disrupt the flow between the pulmonary artery and the left ventricle. All right, along with this, we have information about cardiac output and cardiac index and CVP. Having this information, plus you have to know what's the patient problem, like history, physical exam, echo findings, chest x-ray findings, and I&O's findings, because that tells you the volume status in terms of how much the patient received volume and how much output in the urine. Is the patient 10 liter positive or 2 liters negative? That makes also a difference. Looking at the labs as well, and looking, is the patient on any inotropes? If you don't know any tropes, we'll come to that. Or vasopressors. So you have to know all of this in order to be able to interpret these numbers. Without this information, you cannot just rely on the numbers here, because simply you may have increased CVP, for example, right? And then the echo telling you there is RV failure, and you know the patient had just cardiac cath and had RV infarction. You know these people are preload dependent. So instead of giving them, because venous return has a great effect. Venous return, technically you can say it can decide what's the preload. So in these people, you cannot say, oh, they are volume overloaded, they need diuretics, they need what? They need fluids. On the other hand, you can somebody with severe diarrhea and have low CVP and then low blood pressure, all this, signs of dehydration, then you give fluids.